We are being scammed by people who know what they are doing. It's not accidental. The SHA it's not that the SHA chief is not working. It's an extortion scheme. It's supposed to get money out of Kenyans and transfer that money out of the Kenyan economy.
Imagine paying for health care only to find that the clinic doesn't exist. Yet, taxpayer money flows into thin air, shrouded under the label of ghost hospitals. In Kenya's latest SHA scandal, these aren't horror stories, they are headlines. Let's start with Ladnan Hospital in Wajir and Pangani, an alleged ghost clinic tied to Dr. Abdi Mohamed, the very chairman overseeing SHA. Credible watchdogs revealed that in 1 month, Ladnan allegedly received 52 million Kenyan shillings, eclipsing what major referral hospitals got combined. For context, this is not small change. This is capital reserved for high-capacity, high-impact institutions. And the fact that it allegedly went to a couple of small clinics raises immediate red flags. Dr. Abdi responded firmly. He says he's no longer the owner, having sold majority stakes in 2017. Today, Ladnan supposedly belongs to Metro Group PLC under new leadership since 2023. But the optics remain problematic. How does someone who once founded a hospital receive life-changing payouts as the head of the institutions regulating those funds?
I want to assure the country that the challenges of fraud and corruption that had bedeviled the NHIF, they will never be, as so long as I am in charge, they will never be in our universal health coverage plan.
Now Nyandiwa. SHA's books show nearly 20 million Kenyan shillings paid to a level 4 facility in Homa Bay. Critics called it a ghost. SHA shot back. This hospital has existed for decades, just upgraded, and the confusion stems from naming a glitch with an abandoned dispensary nearby. Still, the public's anger speaks to a deeper failure. Trust has been eroded. A social media voice at Sholad_Man City alleges another ghost. Skovic Healthcare Services in Mount Elgon claims 5 million Kenyan shillings here, 3 million Kenyan shillings there. Small doors, big payouts. Yet mainstream reporting hasn't confirmed it. That void, it's not just silence, it's a flashing warning sign. Where there's smoke, there may be fire. But journalism must chase that fire, not wave it away. Here's how supposedly this works. Create a fake clinic, a humble room masquerading as a hospital. Siphon millions via SHA claims. When scrutiny comes, shut it down under Duale's ban. No arrests, because following paper trails is harder than chasing ghosts. Then repeat, just cycle in a fresh ghost.
The Social Health Authority has suspended a total of 40 health facilities found to have engaged in these criminal activities. They have engaged in corruption and they have engaged in the theft of public resources. These suspensions are effective immediately. Any healthcare provider whose information is used to defraud SHA shall be held personally liable, as is the case for the 8 doctors and the 4 clinicians. For example, submitted falsified medical records in support of claims for a patient who was concurrently admitted in another facility. The 4th issue that the system has flagged is multiple billing and the presence of ghost patients.
It's a scheme many believe that weaponizes bureaucracy, not bullets. Ordinary Kenyans are now asking, why isn't my facility funded? Why don't I see doctors? Reason? Money meant for health, the collective health, is vanishing allegedly into thin air. Meanwhile, elected officials speak of reforms while ghost hospitals feast on budgets. This is not just policy gone wrong. This is the theft under a white coat.
If a private healthcare facility is generating sufficient patient visits, there is an instruction that has been given to Savannah Informatics to put the claims from that private or faith-based facility in hold or reject because of the need to protect or to enhance the equipment project that was launched the other day, away from private and faith-based facilities which serve more than 50% of Kenyans.
So we are dealing with a situation that is very, very dangerous, that the Ruto government is fully behind it, and Ruto personally is responsible. He claimed that he's not a fool to commit the government to buy software at a cost of 104 billion, or for more than 100 billion. But the facts speak a different story. They have done that, so they know very well what they have done, but because they have been exposed, they are trying to play with our minds.
We cannot continue using a system that is clearly a proceed of crime. It appears that the only people for whom SHA is working are the ones who are getting these commissions, the 2.5% from my monthly contribution. You have told us that they have to be paid on a daily basis. And yet the facilities themselves do not get similar treatment when they ask for reimbursement for their claims, Madam Skovic. So can we, with finality, say something? Can we take drastic action? Because some of us do not mind being a bit rash if we are going to do something that is in the best interest of the country. Can we agree before this committee that we want to terminate that contract, and what are going to be the consequences? Because we can't continue to allow people to enjoy proceeds of crime. Let's just declare this SHA and SHIF a criminal enterprise, and we'll close it to date.
Every report that comes before you, where I pay attention to what says. So already I have concluded that there was no effectiveness or lawfulness in the use of public resources under this matter.
Let this be the spark, not the end. Many Kenyans say, demand audits, demand transparency, demand answers. Because in Kenya, if health is a right, then everyone must fight for it with every fact, every voice, every click. Don't let ghost hospitals steal the story. The future of Kenya. SHA scandal has shocked Kenya. It's not just 2 hospitals, or 3, or 4. The number keeps increasing as Kenyans begin to interrogate the list of hospitals that have been receiving payouts. What do you think? Should Ladnan Nyandiwa be arrested, or the SHA CEO be arrested? Drop your comments. Newsroom, Maisha TV, Bushabi Jr.